Hi, it's Lucy Ashkenazi. I'm a podiatrist and diabetes coach for women. Today, I want to talk about depression and what we can do to tackle it. We've seen that depression is very present in people who have type 2 diabetes, and that's no surprise really when you have to be so careful every minute about what you eat, what you do, what you can do, what you can't do. It's just overwhelming. So a good question is, what comes first? Is the depression in the first place, or is it depression in the first place, or is it the type 2 diabetes causing depression? I think it's a mix of both, actually. I think many patients um, suffer from depression, and therefore they don't put so much attention into their daily habits, and they have a routine that isn't healthy, which eventually leads to type 2 diabetes over a long period of time. And also, obviously, as we said, type 2 diabetes, because it's so restrictive in terms of food and habits, and just because we have to think all the time about what we have to eat, that in itself is very depressive. So what can we do to tackle that efficiently? And especially as women, like, we it's very easy for us to get a negative thought and have it rumbling in our mind like all day, and then we find it very hard to step out of that mentality. Like, we're in a negative thought pattern, and we stay there, and then the next day again we have this negative thoughts, and again. So we have to learn how to step out of it. We have to notice, okay, I am thinking negative thoughts. Let's see why that's happening. Like, what triggered these negative thoughts? Um, if it's a reality, a difficulty, the difficult time that you're going through, it's okay to feel it. It's okay to sit with it, accept it, and you can cry, you can shout, you can really feel that emotions, but you have to let it go. You really have to let it go at some point, especially if it's something that you have no control of. And if you keep being depressed because of issues that you cannot change, you have to let it go, because they're gonna keep you from reaching your goals. They're gonna keep you from going forward in life, and they're just gonna be like holding you from moving forward. So that's the first thing. If there are things that you can change, you're going to feel so much better if you actually take action and start changing them. And I know taking action is very difficult. It's the most difficult thing to do. Like, starting is very hard, but once you get the ball rolling, you're unstoppable. And I want you to believe that. Um, it's the same with exercise. Once you start having a routine, once you start having this habit of exercising, and you get used to it, you get used to the after feeling, you're going to have a very hard time to stop it, because it's going to make you happy, it's going to make you feel better. But the most difficult part is actually starting it. And it depends solely on you. You have to make the conscious decision to change your habits, to change how you live day in, day out, and start making things more organized in your life, and just doing the things that you know are good for you. I know it sounds easy to say, and I know it's very difficult to live with type 2 diabetes. My great grandmother had it, and it was really hard. But if you start now, you've got a better chance of getting it under control, especially because we're seeing that patients with type 2 diabetes are increasingly younger, and the younger you are, the easier it's going to be to put it into remission. Regarding happiness, just being just generally happy, you have to make the conscious decision to be happy. And I remember a friend asked me, Lucy, but do you think being happy is actually a decision? And I had a thought about it, and my answer was yes. You need to make the conscious decision to be happy. Like, whatever situation you're going through in life, decide to be happy no matter what's going on, because being sad, being negative, being depressed is not going to get you anywhere. On the other hand, if you make the decision to be happy no matter what happens in your life, if you're content with the current situation, it doesn't mean you can't make an effort to become better. I hope that makes sense. Like, you need to accept yourself as you are right now. You need to accept the situation as it is right now and strive to make it better each day. Love yourself right now and don't say, oh no, I have to lose 10 pounds. I love myself when I lose 10 pounds, or I love myself when I change this habit or stop smoking or whatever. No. If you want to make a change in your life, you need to start by having this mindset of self-love. And I repeat that over and over again, but it's so important. If you're not doing what you're doing out of love for yourself, you're gonna stop, and you're not gonna be able to stick to it. All the choices that you make that are related to your health and making it better, they need to be coming from a place where you love yourself so much that you want to make a change for yourself. You want to show yourself that you love yourself in every way, and you truly want to become healthier. That's the most important thing, in my opinion. If you don't do things because you care for yourself, you do them because you're forced to do them or because your doctor told you to do them, you're not going to make lasting changes. You're going to do them for a week and then that's it. You're going to quit. So we tend to look for love and attention and care from other people, when in reality it has to come from inside of us. We don't need outwards attention if we are not full within ourselves. And that's the most important thing when trying to make a change in your life and trying to have better habits, a healthier lifestyle. It has to start within you, and you have to dig deep inside yourself. You have to find your weaknesses. You have to deal with them. You cannot hide from your fears and your worries. You need to face them straight in the eye. And that's the most important thing. Like, if you are not aware that you are responsible for your present, you won't be able to take the necessary actions to change what you don't like in your present. So it's very important to accept that we are where we are because of our decisions. And it's a good thing, because it means all the power is in your hands to take what you currently have, like take that package and do whatever you want with it. Like, you're in control. You can modify your reality. You can change it. You can make it better if you want to, but you need to take action. It's not going to happen on its own. You need to have a plan. You need to have structure, and you need to take action. And in terms of putting type 2 diabetes into remission, those actions are not that complicated. What matters is consistency. It's more important than intensity. It's more important than perfection. It's just consistency. That's the key. And we're seeing so many diets and like trends in terms of nutrition, keto, whole food, plant-based, gluten-free, Atkins diet, you name it. All of this is like secondary. Like, if your mindset is not on point, it doesn't matter what diet you do, what diet you don't do, it's not going to work, because you're not going to stick to it. So please believe in yourself. Believe in the ability that you have to take action and to change your life yourself. You don't need to rely on pills. You don't need to rely on doctors. Of course, if you're only starting out and your blood sugar is through the roof, you're going to need pills, you're going to need medication. But don't let anybody tell you that type 2 diabetes is a chronic, progressive disease and you're going to eventually end up needing insulin therapy. That's not true. I mean, if you take action, if you decide to be responsible for your health, you don't need to reach that point. Like, I am absolutely convinced by that. And that's why I do what I do. As a podiatrist, I've seen the disastrous complications that can happen in the foot, leading to amputations. You lose your limbs if your diabetes is not under control, and there are so many other complications that you can avoid. And that's where I started what I started. I want you to prevent that in all cases. I want you to really not reach that stage at all costs. I want you to avoid that, and I want you to thrive. I want you to like discover how powerful you are and how much control you have over your health, because somebody needs to tell you that. And if it's not the doctors, if they're just telling you to take pills, it's not okay. Like, somebody needs to tell you that your health is in your hands, and all you have to do is really take action. It's not easy. That's why I try to coach you as best as I can, so that you can do this efficiently, and especially that you're not doing this alone, because we know that lifestyle changes are very hard, and if you're alone doing this, you don't have any support from anyone around you, it becomes an impossible task. But nobody can do it for you, so it all starts with you, and that's the point of this whole video, and I hope you understand. Thank you for watching, and I'll see you in the next video.